We're ready.
Well, good morning, everybody. Welcome to the first ever Georgia Virtual Fall Institute. For those that don't know me, my name is Lawrence Harris. I am the president of the Georgia chapter in what has been a strange and wonderful year so far, not just for our chapter, but certainly for the country. Very, very happy to have you all joining us. We're very excited about the next couple of days. I'm going to use the term fun. It's been a lot of fun. It's been interesting, adapting our delivery of education and services for our community to a different environment. I know all of you have probably spent way more time on forums like this on Zoom than you'd like. And so we just appreciate that you took the time to join us, and we think you're going to have a lot of great education and hopefully take advantage of just the creative and unique ways that we're trying to deliver on what is always one of our favorite events of the year with the Fall Institute. Just some general housekeeping items. We are wanting to get anybody who needs education credit of any sort, CPE or otherwise, ANA, whatever your needs are. But to do that, there's a couple of specific steps you need to make. First is you need to make sure that you've signed in with your full name. This is how we're going to record the information for folks that they're here. So to do that, you click that button at the bottom. And if you see your name and it's both your first and last name, you should be good to go, nothing to do. But if it doesn't, if it says something else, if it's got your, someone else's name on it or just your first name, go ahead and click that more button and rename yourself. And then also put a dash and CPE. And that will let us know that you're someone that is needing the educational credit so that we can provide that tracking for you periodically throughout the sessions today and throughout the conference. You'll want to do the same thing every time you log in. And we'll be doing some polling questions just to record that folks have stayed involved throughout the time of the education, so there won't be any problems when you get that credit. I wanted to provide a few thank yous to folks who've been involved with this conference. Sorry, I'm going to get my notes here. Part of the challenge is you don't have your usual tools available. We have an amazing education team, and it starts with your moderator today, Lori Heavey, who has set up all of the Zoom wizardry for us. She also runs our webinar program through the year. She's been fantastic. If you don't know Lori, you should know Lori. Lori, we can't thank you enough for everything you've done to get us up and running. You're amazing. Sherry Thrasher, Chris Bird, Brian Patterson have all been involved with the CVEN and technology and communication side of things. Hopefully everything runs smoothly. If you all are here, it seems like it is. We have the app running and you've been able to find our sessions, which is step one. Valerie Barkoff was a big part of the team for helping us get our educational program running. Max Smith is going to run the technology tomorrow for our hybrid day, where we have some folks who will be in person and some folks on the virtual. And then I can't thank Ariel Biggs and Laura Holland enough. These two dynamic duo have really moved mountains to pull this all off. So hopefully you get them and everyone else. And lastly, I just want to make a plug for our silent auction recipient, which is a More Healing Kitchen. If you haven't checked out the silent auction, all of that can be accessed through the app. You can learn about it more. We'll have Maria from that great organization coming to be with us tomorrow at lunch to talk more about her initiative and her organization. But there's some great items for auction that we'd love for you to take a look at and ultimately bid on. Let's bid those numbers up. And we will have that auction open all the way through the end of the conference. Would love for everyone to participate in that. And lastly, I want to thank our sponsors. This has been a different kind of year, and we recognize that as a result, everyone's budgets and time and priorities have been shifted. Those who've stayed with us through as a chapter sponsor, or those who have helped sponsor this event, man, I can't thank you enough for your support. All of the sponsor logos and information is also available in the app. Please go check them out. And if you need services, please look to them first. Without them, we couldn't do any of the things that we do. That's all I have for housekeeping. I'm going to get off the stage. I want to turn things over to Carie Summers, who's going to kick off our conference this year. Carie is not a stranger to the Georgia chapter. She's been involved in our board for years and years as the liaison to GHA. And she has provided a legislative update for us and most of our fall institutes. It's always a good one to have. An interesting year to be providing it, and certainly an interesting time. And so we're just very thankful to have her here. Do a quick intro. Carie joined the GHA in 2009, and she's the current CFO and Senior Vice President of Financing. So she oversees the association's finances as well as represents the financial interests of association members when working with government payroll sources. Prior to that, she was CFO at the Georgia Department of Community Health for 6 years. And there she was the primary financial advisor to the commissioner and other agency executives in the administration of the state's Medicaid and CHIP programs, the state health benefit plan for state and school employees, and the state public health activities. Prior to that, she worked for the governor's office of planning and budget, providing fiscal and policy recommendations to former governors Roy Barnes and Sonny Perdue on Georgia healthcare issues. She has a BS in business administration from University of Florida. And like I said, she's been on our board for many, many years, and we're lucky to have her. So without further ado, I turn it over to Carie.
Thanks, Lawrence. Well, good morning, everybody. I'm going to just go right to my first slide because what a strange time we are in. And if you're like me, I've got a little bit of an election hangover. And so, you know, and just to have a little levity, we clearly don't know what, you know, what the final outcome is going to be unless something's happened in the last 30 minutes. But I think the important thing is that, you know, we're going to stay calm, keep moving forward, and roll with the flow. And that has happened before, and it'll happen again. And, you know, we'll be okay. And hopefully the country can move on, and we can figure out what that's going to mean for healthcare going forward. Because the elections have just happened, my presentation doesn't really consider any significant changes that might come from a change in administration at the federal level or even at the state level. Frankly, as you, I'm sure, are aware, a lot of these are just so close, even before the elections, as far as predictions of what was going to happen, that it's kind of anybody's guess on which way things will go and what that will mean for kind of the state of healthcare and particularly legislative actions that may happen as a result of changes. So I'm just going to acknowledge that we've obviously just had an election. We'll figure out what all that means somewhere down the road. But as I said, we'll stay calm and keep moving forward, and I will jump into the meat of my presentation. So today we're going to talk about the budget process from this past General Assembly. I'll go over some of the healthcare budget items that I think might be of interest to you. I'll talk a little bit about the funding that is available to the state and then therefore to constituents and stakeholders of the state related to the coronavirus funding. And then I want to spend some time on two waivers that have just recently been approved that are designed to help address the issue of the uninsured in the state. All of those things are certainly important to healthcare providers who are their job every day is to provide healthcare, kind of regardless of whether somebody has insurance or not. So it's sure nice when someone comes in the door that does have a payer source that can help offset the cost of providing that care. And then finally, I'll wrap up with kind of the outlook for next year going forward and what GHA is, planning to be working on in the next General Assembly that will start in January. So certainly feel free to interrupt if you have a question through the chat. I know that's getting monitored, so I'll get a little help in letting me know that you might have a question, but I will do my best. So let's talk a little bit about this session in 2020. And I'm going to move my pictures over here. Let's see. Okay, so getting to a fiscal year 2021 budget, and it is strange times. This was certainly an unprecedented session. Started off pretty normal. It convened the 1st of January, which is as required by law, the second week of the year. So the General Assembly convened, and the governor shortly thereafter released his two budgets, one for the amended year of 2020 and one for fiscal 21, which was the budget that began July 1st of 2020. So we get all the way to March 10th, and which was day 27 of the General Assembly. I think everyone is probably aware there's a total of 40 days that the General Assembly can convene. Now, they can stop and start that calendar, and they often do. This year, they really had to do that because of the coronavirus. So on day 27, the House passed their version of the fiscal year 2021 budget. And one thing I want you to look at is the graph, and that is the state funds that were available to appropriate changed between January and what was finally, of course, passed in June. So just to give you a frame of reference, we had $27.5 billion in state funds in the 2020 budget. And when the governor came out with his budget in January, he had added additional monies to the budget. And so his revenue estimate was $28 billion for appropriations. Well, when the House, of course, the House and the Senate don't really have direct control over the revenue estimate that is used for appropriations. Now, certainly they can pass legislation that will change the amount of revenue available, but it is the governor's responsibility to set the revenue estimate accordingly. So really what happens typically is the governor sets the estimate, and then the House and Senate work within those dollar amounts. So when the House did their budget, they passed a budget worth $28.1 billion. Of course, their version was a little bit different than the governor's version, and that's typical. They have their own priorities, and there's a lot of negotiating and horse trading, if you will, that happens during that process. So 2 days later, they ended up adjourning because of COVID, and were basically on a break for 2 months, an unprecedented adjournment in the middle of the session, and they did not come back until June 15th. In the meantime, the 1st of May, because of the economic impact of COVID, the agencies were told to prepare a revised 2021 budget that reflected a 14% cut as compared to what they had been appropriated in fiscal year 2020. So very significant. They were told the 1st of May, and I believe they had to have those revised budgets in by the middle of May, so that the governor's office of planning and budget and the budget offices for the House and Senate were able to work through those. They did have a lot of committee meetings prior to the General Assembly reconvening. Of course, all of those were virtual because of the virus. So the 14% cut was really obviously a huge amount, but what was even more unprecedented about that was that all three budget directors of the governor's office, the Senate, and the House all sent out a joint memo to agencies telling them to do that 14% cut. So they were all in lockstep that they knew that there needed to be a reduction in the appropriations for 2021 because of the economic impact. So they come back June 15th, the General Assembly resumes, and 4 days later, on day 34, the Senate passes their version of the fiscal year 2021 budget. And I want you to notice that the Senate, bless their hearts, they had a tough job in that instead of them being able to appropriate $28 billion, they had to cut down to $25 billion. And that was what their budget was. That was the dollars that they passed because of the economic impact of COVID. And so that's very difficult for elected officials that were in the Senate. All of them were up for re-election. And to have to say, you know, the Senate cut this amount of money when their counterparts in the House, for example, did not have to do that. It was, I think, very difficult for them politically. Nonetheless, they did the best that they could. I know it pained them quite a bit to go in and have to make some very serious cuts. If there was good news, is that the next day, in preparation for wrapping up the session, the governor changed the revenue estimate and agreed to use about $250 million in what I call the rainy day fund, but it's the shortfall reserve fund. And so exactly as that sounds, there is a rainy day fund that, in years where there's surplus, the General Assembly and the governor can decide to add, actually it's the governor, can decide to add to that shortfall fund to be used in these kinds of economic downturns. That happened in 2008, and of course it again happened this year. So not only did they use $250 million for fiscal 2021, they also used it to get through the remainder of fiscal year 20 and to effectively shore up what was a pretty big drop in revenue in the short term after COVID really started impacting the state in March through the early summer. So they did pass a budget. They did come to agreement at the very last day, day 40, and just in time because the state fiscal year started July 1st. And so the governor had to pretty quickly get that bill signed so that those funds were made available and state government could continue to operate. So that's why I say it's strange times. I think it's unprecedented. There's never been a session that, as far as I know of, that has taken that long simply because there was such a big delay in the General Assembly able to do their work during the session because everybody was at home and quarantined. All right, so this is what the actual appropriation ended up looking like. And if you compare the pie charts and the breakdown on the health component of it to prior years, aside from the total amount of the pie, really the breakdown is pretty similar. More than half of the money that the state appropriates goes to education. A quarter of it or so is going to healthcare, and that's including behavioral health, community health, which has has Medicaid, the Children's Health Insurance Program, and the Department of Human Services, as well as public health. And then the other 24% or so is basically everything else. State appropriations are down 6% from what they were in 2020, and that's a very significant cut as compared to what it certainly was dollar-wise. But at one point, given that they thought it was going to be 14%, people were actually pretty happy to see that it was only 6%. So that certainly is a case for putting things into perspective. So now I want to talk a little bit about what happened on the healthcare side. So let's talk a little bit about Medicaid. And a lot of these budget areas in healthcare, I think the big story is what didn't get cut versus what got added, because appropriations were down, and the state, of course, has a very conservative track record of wanting to err on the side of being conservative. Their first priority was to restore a lot of the cuts that the Senate had to do, and so they were able to do that, and then they were only able to do a few things. The General Assembly, from the Medicaid perspective, continues to try to focus on the issue of maternal mortality. And of course, unfortunately, Georgia's numbers for maternal mortality are really not very good. We're very low ranked in the country in terms of those mortality rates. And so there's been a lot of focus in the last couple of General Assemblies of trying to do something to address that. So this year, legislation was passed that allowed a Medicaid coverage to be extended to 6 months of postpartum care to mothers. Currently, it was 30 days. So the fact that they can get an additional 5 months of coverage for postpartum is certainly key to healthy future babies in terms of taking care of moms certainly after they deliver, and then to the extent that they have other children down the line, that postpartum care is important for that. They also increased coverage or provided coverage for lactation care and services as well. So those are some new coverage options in Medicaid that had not been available before. They were able to do a few things on rates. The payments to physicians and physician-related providers is linked to a Medicare fee schedule, what they call the RBRBS. And so, unfortunately, every year, even though Medicare updates those rates, Medicaid doesn't necessarily do that unless they have new funding from the General Assembly to pay for that. And so the primary care providers, the professional associations that represent them, that's everybody from pediatricians to OB/GYNs, et cetera, all work together to try to come up with a proposal on increasing those primary care codes. And so this year they were able to get a 1% increase for 108 of them. In other years, they've been able to get across the board increases, or they've been able to update to a newer schedule. So this year it's just a flat 1%, but only for 108 codes. There's still a lot of focus on care in nursing homes. I'm sure you've probably seen some of the articles about the state's oversight of nursing homes and assisted living and other long-term care facilities. And so from a budget perspective, the General Assembly wants to put money where they want to put money where there's quality and promoting quality. So they've put money in, they continue to expand the quality incentive programs for nursing homes that are serving Medicaid patients. They also did a 3% increase in the nursing home ventilator reimbursement rate. And, you know, unfortunately, because of COVID, this was a really important, I guess, increase, you could say, because unfortunately, some of the sickest patients needed to be on ventilators. Now, a lot of those were in hospitals, but for those that needed more longer-term care, making sure that there were enough nursing homes that had that ventilator support, that 3% increase helped to do that. And then they also recognized for our teaching hospitals on the inpatient side, Medicaid's share of the cost for both new programs and expanded programs for teaching hospitals that have residents. So we're happy to see that, of course. Those programs are very expensive, and of course, it's a key to promoting healthcare access and improvement. From a financing perspective, one of the big things that did help the state out was an increase in federal matching funds. I think everyone probably is aware that Medicaid is a federal-state partnership. The federal government puts up about 67% of every dollar that's spent in Medicaid, and the state puts up the difference. And as part of the CARES Act and some other federal legislation that was passed related to the COVID-19, states got a 6.2 percentage point bump temporarily. In other words, the federal government is going to pay 6.2 percentage points more than they normally do through September of 2020. So what that did was it allowed the state to free up state funds that had been otherwise earmarked for Medicaid and use them in other parts of the budget to kind of shore up since state revenues had been down. After that, we go back to what we call kind of the normal FMAP update. And sort of the irony is that prior to COVID, Georgia's economy is doing very well, and the amount of federal matching funds that are provided to states is directly related to the state's economic prosperity, if you will. It's a formula. It looks at per capita income and other things. So as a state does better economically, the federal government puts less money in because the idea is the state can afford to do more. And so the normal course of events had us seeing a reduction in what the federal government was going to provide beginning next year. And of course, that was kind of a short-lived thing, and that's why they put the 6.2% increase in there. Over in the medical education and healthcare access, as I mentioned earlier, a lot of this is what they didn't cut versus what they added. there was a whole series of reductions in the medical education area prior to the final passage of the budget. And so I know that really pained the General Assembly, who have worked very hard to try to increase funding for medical education, both on the graduate and undergraduate side, as a way to, meet the shortage that we anticipate for physicians and other practitioners and clinicians. So they were able to restore a lot of the cuts to kind of hold some of these programs harmless. They weren't able to do a whole lot. They did provide some new funding for medical schools over in Athens. Augusta University and the University of Georgia have a medical partnership, and so they expanded, they provided funding to expand that. And they also provided some operational funding for Mercer School of Medicine's new campus down in Columbus. That was certainly a positive thing. From a residency program, usually we would see additional residency slots and increases in capitation rates to teaching hospitals that are participating in those programs. This year, those were held harmless. They weren't cut, but they didn't get new money except for a new rural psychiatry program down in Moultrie. Over in healthcare access, they still are doing quite a bit of work for rural hospitals and trying to come up with solutions to keep rural hospitals open. So they've added $12 million in rural hospital stabilization grants, which is really big. It had been around $3.5 million, so it's a very sizable increase. Those grants go to different hospitals who are trying different models of care, and that can include things like, partnerships and other relationships with different, maybe larger hospitals or larger health systems, or even other community providers in terms of making sure people are getting care in the right location. So that's a very big boost to that particular program. And then legislation was passed, and then funding was added to the budget as it related to planning and implementation for an all-payer claims database. And so this idea of having all-payer claims in one database has been around for a little while. And so funding was put to kind of kick it off and get it started, figuring out how it would be organized, who's going to manage it, and who's going to have access to the information. But the idea is, of course, if you have the data all in one place, that you can mine that data and you can come up with, all kinds of analyses for health policy issues and to address various payer issues, both from the insurer side or the payer side as well as the provider side. So that's in its infancy, but we would expect to see more activity in that area going forward. And then, as usual, they did some startups for the federally qualified health centers, a couple, again, rural areas to provide primary care in some underserved places. Over in the public health budget, the health departments really, again, and this is back to, it was an arduous process to get through the budget, where, again, lots of cuts. And again, this is a case where there had been very significant amounts of cuts, and those were restored, fortunately, in the final version. So there was a marginal reduction, and I say that marginal 1%. I mean, that's still a reduction, and that's not good, but it had been much, much larger for the department. And what was hardest hit were the local grant and aid funding to the county health departments. So that got restored, and that's certainly very important. Public health has been a key player in the COVID, the management of the COVID pandemic, and trying to keep up with testing and where outbreaks are occurring, and just keeping up in general with the status of that. The budget did recognize about $300 million in federal funding from some federal legislation, the CARES Act and Paycheck Protection Program Act, for coronavirus. Most of the money was available to the state for testing, but a fair amount of it was also available from the CDC for just general research about what was going on with the disease and trying to manage it. So the state health benefit plan coming up for 2021, the good news is there's really no changes to the copays, coinsurance, or deductibles. So the plan design has stayed the same and the insurers are the same. Members this year were asked to pay an additional 5% on average, depended on which plan they picked and which level of coverage. But in general, it was 5%. That was after a several-year hiatus in increases. So I think by and large, state employees and teachers probably weren't too surprised to see the increase. Nobody likes to pay more, but I don't think it was anything that people were not expecting. From a retired member perspective, those folks are in a Medicare Advantage plan. They can pick either from two different levels provided by both United Healthcare and Anthem. And so if they pick the standard for United Healthcare, they don't pay anything in a premium. But if they pick the premium Anthem one, that's the most expensive. They may pay up to $312 per member per month. So for 2021, their goals are to explore opportunities for additional member benefits. They've expanded some wellness benefits, particularly for people that are diabetic and have some other disease states. But overall, the plan is kind of under the radar and is sort of rocking and rolling along with not a lot going on with it. All right. I wanted to briefly talk about this coronavirus relief fund. And it really was not in the budget, but it is such a significant amount of money that has been made available to the state. And this is in addition to the money that I already mentioned that went to public health or that was recognized in the budget for public health. This is called the Coronavirus Relief Fund, and it's actually administered through the Treasury, Department of Treasury. There's not a lot of information, recent information specifically on how Georgia has spent their dollars so far, but it's a total of $4.1 billion to the state of Georgia for coronavirus relief, and that is, of course, expenditures that states and some local entities have spent on the coronavirus pandemic, responding to it, that were not budgeted, that have been incurred after March 2020 through the end of this year. So there's some reports published on the Treasury's site in terms of how states have spent their money, but that data is only through June 30th. And so the pie chart shows that most of it has been a pass-through, transferred to other governments. So in other words, the state has passed that along. They've spent it on, of course, medical expenditures and public health expenses. Those are the big pieces of it. Going forward, if you look at the list over on the right side of the page, the $4 billion is actually broken into two pieces. And this is based on the actual federal legislation. So it's not the state deciding, it's the federal government saying, the state of Georgia gets $3.5 billion out of the pot, and then the remaining $600 million or so is going specifically to the city of Atlanta, Cobb County, DeKalb County, Fulton County, and Gwinnett County. And again, that's a federal decision, not a state decision. As for what the state is going to spend their $3.5 billion on, the big news recently is the governor announced that he was going to use $1.5 billion of it for the Unemployment Trust Fund. And effectively what that's going to do is it helps all employers in the state, because if they didn't put the money in there, because there have been so many unemployment claims as a result of the coronavirus, the premiums that employers would have to pay back to the state would increase significantly. So the governor is going to use the $1.5 billion to shore up the unemployment fund, the trust fund, so that employers don't see those big increases in premiums going forward. He's also committed to use $400 million to match FEMA grants that are available. Certainly, they've used the Georgia National Guard quite a bit, particularly to go in and do cleaning on a lot of the long-term care facilities that had, unfortunately, multiple residents with that were tested positive. They're also helping hospitals pay for staffing augmentation. The big challenge for hospitals, of course, tends to be that if their staff get sick because they have the coronavirus, then obviously they're ill and they can't work, but then they're also under quarantine and can't work, even if they are asymptomatic, for example. So trying to find folks to fill those slots and meet what is an additional demand for healthcare services. The state is using some of its money to pay for temporary staff, and a lot of those staff are coming from out of state to the state to help support the providers. $113 million to nursing homes. Obviously, that industry has been very hard hit by the virus. And then $105 million to support student connectivity and education. So that is helping school systems make sure their students can get online and continue to have access to their teachers virtually. So that doesn't add up to the entire $3.5 billion. That's all that the governor has announced at this point in terms of what he plans to use those funds for. But who knows what else is going to come up that he may need to add to that. So at any rate, I wanted to mention that, again, not really a budget item in the Appropriations Act per se, but certainly a big, big amount of money that's come into the state. Okay, so we do have some good news. I talked to you last year about two new waivers that the governor's office and the Department of Community Health and the Department of Insurance have been working with CMS to get approval on. And there's two pieces of this. There's what they call the 1115 waiver. This is a Medicaid demonstration waiver. And this was just approved by the feds on October 15th. They had submitted this after public comment, and in fact, last year when we were at the Fall Institute in Savannah, they had a public hearing in Savannah to hear comments about what they had proposed for both this waiver as well as what we're going to review a little bit later, called the 1332 waiver, which is an insurance waiver. So based on that feedback, they submitted their waiver application in the end of December. And so they have been, of course, discussing it back and forth with CMS, and they just got approval. So I want to just go through a little bit about what this is going to look like, because it means more people will be accessing health care with coverage. They'll have Medicaid coverage. This is to begin next July, so July 1st of 2021. That's really not that far away, even though it seems like it. So, of course, they've got to, now that they've got approval, they've got all of the logistics to get ready and to get this up and running. But that's their plan. Basically, the people that are covered are those, of course, that aren't already on Medicaid, up to ages, these are adults, up to age 64, and their income is less than 100% of federal poverty level. And I put over here on the right, if you look at the family size box down in the lower right, just to give you an idea of how much 100% of federal poverty is, if you are a family of one, that's a little under $13,000 a year. So these folks are not, making a lot of money, obviously. And you can see as the family size goes up, the amount of money goes up slightly. The big key to this waiver is that the folks that will be eligible have to be working or trying to work. And so that's different than a sort of traditional Medicaid expansion, which is you're eligible based on you meeting certain demographic requirements. This is actually an activity requirement where you have to be, again, either working or engaged in work. So the program projections, so year one, they're anticipating $25,000 to be covered. And then by year 5, which again, this is a 5-year demonstration. So they're having to prove is that covering these folks is at least budget neutral, if not a cost savings to the state versus having not covered them under a traditional plan. So $25,000 the first year, $53,000 by year 5. With the state costs ranging in year 1 from $50 million to about $100 million in year 5. Unlike the sort of traditional Medicaid expansion that was authorized under the Affordable Care Act, the state will not be getting enhanced federal matching funds. If the state had done the full Medicaid expansion, which would have been incomes up to 138% of poverty, with no work requirement, for example, they could have received 90% federal funding. But because they are limiting it and having the work requirement, and they're doing it under this demonstration waiver, they will get the regular matching rate, which was, again, I think I mentioned earlier, which is about 2/3 of the cost. So, so the federal government will be picking up that additional amount. So members who are going to be participating in this, the payers or the insurers are going to be the care management organizations. So these are the CMOs that are already serving Medicaid patients in the low-income Medicaid and the Children's Health Insurance Program. So they're going to use the same infrastructure that they're using for that population of Medicaid. So these folks will have premiums, and so I gave you some ideas of the premiums over on the right. Premiums are only going to apply to people that have 50% of FPL or higher. So if you have less than 50%, you're not going to you won't have to pay a premium. For members who are married and their spouses will be getting coverage. If they are also individually eligible, there's a marginal add-on, and then if they are a tobacco user, they will have to pay a surcharge. They do have to pay co-payments, but those are very, basically they mirror the existing Medicaid program. So I would say they have added a copay for non-emergent visits to the emergency department. That is something that is not currently applicable in the Medicaid program. So these folks will have to pay $30 if they use the ER for a non-emergent reason. They are also using what they call member reward accounts, and the idea is trying to create incentives for healthy behaviors. So if they do like a health assessment, or if they stop smoking, which of course they would not have to pay the surcharge, but they could also earn those points, and then they can purchase other items that are not currently covered, things like over-the-counter drugs, dental services, etc. So they're really trying to make this look like a commercial health insurance plan, but obviously heavily subsidized. Their idea, of course, is they want people to get used to commercial insurance so that, particularly for these folks that are working, that as they work and progress in their careers and make more money, eventually they won't be eligible for this program anymore. They would now be eligible for the insurance exchange. And so we'll talk a little bit about that too. So speaking of that, this is the other side of the equation, and this is the 1332 state innovation waiver. This one literally was approved like 3 days ago. So the 1st of November, they received approval, and what they had originally proposed and what I shared with you last year is for the most part the same, but there are a few modifications that they made as a result of all of the public comments that they received. So the first modification is that the program is not going to begin until 2022. And basically what they're saying is COVID and they got a little behind, I don't want to say behind, but they had challenges in getting this implemented because of the state's other focus on COVID and all of that. So there is a delay from what was originally proposed by 1 year. This program has two components. The first is a reinsurance program, and then the second is taking people from the health insurance exchange, which is where you go out to the individual insurance market on healthcare.gov. And instead of going through that website, Georgia would have its own exchange and its own website to provide access to Georgia insurance products for people to pick from. So that's, like I said, two components to it. On the reinsurance side, they really didn't change a whole lot. It's pretty much the same in terms of what the model looks like, the same caps, the same tiers. And so just to kind of give you an idea for 2022, they think this part of the program or the waiver, they expect it to reduce individual market premiums by 10.2%. And so, and they also think that because premiums will be lower, more people will sign up for coverage, and so there would be a modest increase of 0.4% in enrollment in the individual health insurance market because of this reinsurance. They predict that it will cost the state $93 million to basically provide this reinsurance, and so that is in 2022. The second part of it is as I mentioned earlier, the takeover, if you will, of instead of folks going through healthcare.gov, is to go through to a Georgia, what they're calling the Georgia Access model. So, similar to healthcare.gov, consumers can go online and shop and compare. They really want to leverage the private sector to provide education, outreach, and customer service. Now, they did do some modifications to what they originally had proposed. The big feedback they got is people were very upset that they were providing subsidies for non-qualified health plans. And qualified health plans, of course, are those plans that provide what I would call the essential level of coverage and are mostly comprehensive, where the non-QHPs might be, say, more of a catastrophic policy. And so those will not, people can still do non-QHPs, excuse me, but the state is not going to provide subsidies to folks who decide to do that. So those will only be available to people who go with a qualified health plan. And then they've modified the waiver to have more interaction with the federal government as it relates to enrollment and the administrative of the premium tax credits that are currently available for those that have lower incomes probably 85 to 90% of the folks in that are enrolled in the health insurance exchange plan in Georgia, which is about 400,000 of them. Most of them, 85 to 90%, are getting some sort of premium tax credit, which is reducing the cost of the premium and making it more affordable to them. So that will continue under this model, but again, the state will be administering that. In terms of the program projections for this part of it, they expect that this program will reduce the individual market premiums by an additional 3.5%. That's in addition to the 10% that they think the reinsurance component will reduce it by, but this will increase enrollment by 25,000 people. So at a state cost of $144 million. Now, a lot of that is going to be paid by user fees from the insurance companies, but the state does expect to put in some of their own general state funds. So let's see. All right, recognizing we're getting towards the end of my time with you, and I want to leave some time for questions if there are any. Just to talk generally about what's going to happen the next General Assembly that begins in January. Of course, that budget process has already started. OPB came out in August with directions to agencies about what budgets they needed to submit for 21 and 22. And surprisingly, they did not require agencies to reduce their budgets. The OPB director said that because they had taken so many cuts during the last session, and as you know, of course, it was a 6% reduction overall, that had been a very fiscally conservative approach, and that because the state was being conservative and had been conservative, that at this point there was not a need to do further cuts, but they were not allowed to ask for new monies. They have to submit flat budgets for 21 and 22. Some agencies will be permitted to request enrollment or workload-driven growth items, and those are things like for the Medicaid program enrollment growth, or the schools, Department of Education, growth in the number of students enrolled, those kinds of things. So those will be considered. I pulled just to see kind of what state general fund receipts were doing. This is where the Department of Revenue publishes every month what's going on in terms of tax collections. And so I'm somewhat encouraged, at least for what the first 3 months of the fiscal year look like. Of course, it is early, but it looks like we are perhaps on a path to recovery. So if you look at our annual receipts, in 2019, we had 23.8 million, billion. No, millions. No, billions. Sorry. Yeah, I think I would know that. 23.8 billion. That went down to 22.7 in 2020, and of course that was the result of COVID beginning in March through June. And then, of course, year to date, we're at about 6.2, which, if you look on a monthly average, we're really doing pretty well. So, so far, so good. We'll see how that goes. You know, usually we are, again, a very conservative state, and I know the governor's office is closely monitoring to see you know, how these revenues continue to flow in, but we will be cautiously optimistic. As far as the Hospital Association, just thought I would share what our focus will be in 2021. We really break things up into sort of two pieces. One are legislative priorities, and then we have policy positions on a variety of subjects. So pretty much what all this means is that anything that sort of falls in any of these areas, that's something we're looking at, we're monitoring, and you know, we're getting involved with whether that's to oppose or to support when there's changes that are proposed. Our legislative priorities really have not changed in terms of the general, the general overview or the general topics. What tends to change are the nuances of it every year. We certainly are happy about the waivers. The first item of preserving and enhancing access to healthcare for all Georgians and really focusing on trying to reduce the number of people that are uninsured. Those two waivers, while, enrollment in the Medicaid part is around, projected to be around 50,000, it's a great first step. And, we would expect to see other potential waiver demonstrations for other populations down the road, particularly in the behavioral health area, for example. So, while it doesn't get us to everybody having coverage, it's a great first step, and we're certainly happy to see that, and we're supportive of both of those waivers, and so look forward to see those getting implemented. Certificate of need, that seems to be something we're dealing with every year. This last session was no different, but there really was at the end of the day, there was no changes to the CON process. Always looking for assurances that hospitals are adequately reimbursed for the services they provide. Certainly in the COVID environment, and I know there's other speakers later in the Fall Institute that will be, speaking to the challenges of the COVID era, if you will, and what that has meant for hospital reimbursement and financing. And so that's sort of in my mind, this year is, the subtitle under that particular item has to do with COVID and the provider relief funds and all of that. And then behavioral health resources. Unfortunately, the Department of Behavioral Health really took a pretty big hit in terms of funding to the department this year due to the COVID environment and the cuts. And that'll be something we'll be working with the governor's office and General Assembly to try to get those dollars restored and again, to focus on building back those resources and adding to them. So I think with that, I'm at the end of my slides, and we'll pause to see if we have any questions on the Q&A.
We do, Carie. We have one question. And again, I will remind everyone, if you have a question, please submit it in the Q&A box. The question here, Carie, is, did the state provide any information regarding how they will determine and define which ED visits are non-emergent and which will qualify for the new copay?
That is the big question. I am not aware that they have provided any criteria. I will certainly go back and look in the waiver application to see. The list of that in the Medicaid, at least on the fee-for-service side, and of course, the managed care plans, which are going to be the ones that are administering this, each of them have their own policies and their own, depending on what your contracts are, et cetera, on how they pay for emergency claims or emergency room claims. I know on the fee-for-service side, and to some extent the CMOs have copied it, there is a list of diagnoses that if they are either they're either a presenting diagnosis or a final diagnosis on the claim, that triggers it either being paid at the emergent or the non-emergent rate, which is the fixed amount, or it's paid at percent of charges. Now, this is again on the fee-for-service side and not necessarily the CMO. The department used to publish that list and stopped doing that, even though my understanding is they still adjudicate claims with such a list. So we've had not a lot of luck in figuring out what their algorithm is, if you will. I will just as a follow-up, I will see if the waiver says anything specific about how they're going to qualify or define that. And certainly as the implementation is going forward, we'll make sure that that question is answered, so hospitals know who they need to be collecting that $30 from. So I don't know if that's going to be the hospital's discretion or if it's going to be after the fact with the insurer. And of course, if that's the case, that's not good, because then you got to chase them, and we know how that works. So great question. And I'm sorry I don't have a more definitive answer, but it's a good question that we need to pursue.
Okay, next question. Is there a finite number of QHP in Georgia? Were they what you showed at the beginning of the presentation?
A finite in terms, no, there's not a, if you're talking about the types of insurers that are providing a qualified health plan, no, there's not a finite number. They certainly, at least under healthcare.gov, they have to file that they want to be a QHP, but, some years we've had as many as 8 or 9, and some years we've had just a few, and in some places in the state, maybe just 1. So no, I think the idea is that if these are, with the reinsurance program in particular, it will make it more attractive for insurers to want to provide QHPs.
Okay. Again, I'll just remind the attendees, if you have a question, please use the Q&A box. Give it just 1 minute. All right, here's the next question. Under the policy considerations on your last slide, what are some of the initiatives being considered under the topic of patient safety that are being worked on?
That is a good question. Well, the association has ongoing collaborations with, most recently with Alliant, in terms of working with our various members. And of course, our members, we represent just about all of the acute care hospitals in the state. Many of them have chosen to, or we anticipate them to participate with us on a next round of CMS funding for patient safety. We had the Hospital Innovation and Improvement Network that just wrapped up this year, and we'll be beginning what they call Task Order 3, which is sort of the third round of that effort. And that is a whole host of patient safety and patient outcomes, if you will, metrics that the Hospital Association together with Alliant will be working with participating hospitals to try to improve or to see improvement in those measures that are all wrapped around that patient safety. So I don't know so much from a legislative perspective that there's legislation that's related to the patient safety. It's more of just ongoing work that the association conducts with our members.
Okay. Next question, is the Task Order 3 focused on the coronavirus issues?
I don't know that it specifies that because I think I don't recall it being specific to coronavirus. I'm sure there are patient safety measures that will help to, for example, prevent the spread of coronavirus, but those are not solely for the purposes of coronavirus. But that is a good question. I will have to go back and see. I have to admit that isn't, I'm unfortunately not the subject matter expert at the association for the patient safety stuff, but I'm certainly happy to follow up to see if coronavirus is specific. We've just this task order 3 has just been awarded, and we are in the process of recruiting our hospitals to participate. We have until, I believe it's March, to get commitments from our hospitals, and we're looking for, I believe it's around 60 or so. Once we get those commitments and get going, and then we'll be, it is a multi-year program, similar to what the first and second rounds were with the Hospital Engagement Network, which was the HEN, and then the HIN, which the Hospital Improvement and Innovation Network, and now Task Order 3, which there's another acronym for it, which I have not committed to yet, or have not committed to memory yet, but it doesn't start with an H, I will tell you that.
All right, any other questions from the attendees? Okay, Lawrence, that's it.
Fantastic. Thank you, Lori. Thank you, Carie. Excellent, excellent presentation. We really love having you join us every year, and we hope you'll keep doing it. And if folks have questions for Carie after the fact, obviously you can reach out to her contact info. I know she'll be willing to take any of those. And thank you for kicking us off. Wonderful job.
Thank you. I really appreciate being asked.
Fantastic. All right, folks. Well, that's the end of our first session. Thanks for those who joined. Hope you enjoyed the conversation. I certainly did. I thought it was really great. Do what you need to do. Our next session starts at 10:30 with our technology panel. So you should have the links for that. If you have any trouble or can't find it, if you can't get into the app or anything, please don't hesitate to reach out to any of us at the chapter. But otherwise, we will see you all back here at around 10:30. Thank you so much.